Welcome to this presentation on the high deductible health plan and health savings accounts for open enrollment. So this is Andrea Lightfoot-Bassan from the Employee Service Center staff here to present to you. Please note that you can download a copy of the presentation, the slides, at tinyurl.com/ESCHDHP18. So feel free to download a copy of that for later. And of course, you can always go back and watch this video again here. So we're going to get going and just do a brief overview of the Employee Service Center so that you know all of the things that we do in general and that we are here to help you. So the Employee Service Center covers benefits, wellness, FMLA, retirement, and payroll. And those benefits include your medical and prescription plans, your dental, your life insurance, short-term disability, and voluntary benefits like vision and income protection that we'll talk about. The ESC is located at District Office in Building C, Room 117. You're always welcome to stop by and see us, or you can give us a call with your questions at extension 4945 or email us at esc@pima.edu. You can find a lot of information on the intranet under Employee Service Center, and you can also access benefits information through My PIMA by clicking on the At Work tab, and you'll find links to benefits, payroll, wellness, etc. on there. So those resources are available to you, especially if you have follow-up questions. So just a brief overview. To remind you, if you're watching, that the college does have 4 different medical plan options. Of course, we're going to talk about 2 of those today specifically. We have the basic high deductible health plan, or HDHP. That includes the health savings account, or HSA, and that is the base plan. So that option is the automatic enroll plan if you don't choose any other plan or are not waiving. Then we have a buy-up high deductible health plan. So that has some additional premium cost associated with it, but also includes your HSA. And then the other 2 options are preferred provider organization plan, or PPO, or EPO, exclusive provider organization plan. If you want more information on those, I suggest you watch the Navigating Your Benefits presentation to cover open enrollment. Regardless of which plan you choose through Blue Cross Blue Shield, you're going to get coverage for all of your wellness and preventive services, and all of the plans include prescription coverage, which is through Express Scripts. So let's ponder high deductible health plans. Why might you be interested in that? Some people are really healthy and feel like they don't have a lot of expenses and they don't want to pay for coverage they don't need. A great reason to choose a high deductible health plan. Some people are looking for something that's affordable, something that doesn't cost a lot out of their paycheck, but still has coverage to make sure that a family doesn't go into debt and has medical services and prescription services that cover. Some people do have health issues. And they might, again, want a plan that costs a little less out of their pocket, but does cover a lot of medical and prescription services. And some people choose high deductible health plans, especially because of their health savings account and the tax and retirement benefits that are available to them. So this kind of shows that a high deductible health plan is really for anybody. You don't have to just be healthy or want just a lower premium. A lot of different people choose high deductible health plans and health savings accounts because of the different benefits available to them. So I'd like to have us look at high deductible health plans as a house. Your high deductible health plan is your medical plan or your medical coverage. And we're going to look at it as a house today. Because it is insurance. We want that protection, our roof. So a high deductible health plan is going to have different levels of service available. Your basic level is your preventive care. The great thing about that is your preventive care is covered at 100%. So that means no out-of-pocket cost to you. When you start to need services, then you move to the second level. You're going to pay for medical and prescription services at a discounted cost in that level 2 until you meet a deductible. If you meet the deductible, you might move up to level 3. And that means that you might have co-insurance on the plan. So you might pay 20% or you might pay 0% depending on the plan. Now, you might stay in level 3 for a while. Again, you might never reach it. But if you did have a lot of expenses where you were paying co-insurance, you might actually reach your roof, your out-of-pocket maximum. And that is your protection, because if you reach that out-of-pocket maximum on your plan, you will not incur additional expenses for medical or prescription coverage. So that means the college, the plan will cover the rest of the cost. So you have that protection built in. So that's your medical plan side, and we'll look at each plan individually and how that works. But we're going to pair that health plan with a health savings account. This allows you to put money aside in a special bank account that you can use to pay for services on the plan. So it does live separately, but they're connected because you can use that money to pay for the expenses on your plan. Now, high deductible health plans are very similar to other health plans in that you can see any doctor that you want. You're going to find both in-network as well as out-of-network coverage. In-network is always going to give you the best price, but you have that choice. You can choose to see whomever you want to see, and you will find coverage. All medical plans typically have an out-of-pocket maximum, so that's actually similar to other plans. And then you also have all your preventive care covered. So whether it's a flu vaccination, a well woman check, a mammogram, or other preventive tests, those are going to be covered at 100%, just like they are on other plans. Now, high deductible health plans typically also have a monthly premium, but you'll find that it's typically lower. So there are some differences on high deductible health plans compared to other plans like the college's PPO and the EPO. One of the big differences is that the deductibles and the out-of-pocket maximums include not just medical expenses, but also prescription expenses. So all of those get combined together towards the same deductible and out-of-pocket max. Another difference is there's no such thing as a copay on a plan. You're paying the discounted cost of services, both medical and prescription, until you meet a deductible. And then you might have coinsurance after you met the deductible, depending on the plan. Of course, I mentioned there's lower premium costs. And what also makes a high deductible plan stand out is that having an eligible high deductible plan then allows you to contribute to a health savings account, which we'll talk about, a pre-tax account that you own that you can put money into and keep for years and years and years. So let's look at our basic high deductible health plan at the college. Now, it's important to note on this plan that the deductible works very differently than any other plan. But let's start at the bottom. Again, you have that preventive care covered at 100%. So if you go in for your well woman visit or go to get your flu shot, you're going to have coverage at 100%. So no out-of-pocket cost. Now, your deductible on the plan is going to be $1,500 for an individual, or if you are enrolled in employee plus spouse, employee plus child, or employee plus family, your deductible is actually going to be $3,000. So if you're employee only on the plan, if you need expenses, services throughout the year, you're going to pay the discounted cost for medical services, discounted cost for prescription services, and that's all going to add up. And if you reached $1,500, you would have reached your annual deductible, and then you'll move to level 3. Now, if you have 2 people on the plan, your deductible is actually $3,000. Even if it's just one person having those expenses, because you're enrolled in a family plan, that deductible is $3,000. So again, medical services, prescription services, you pay those discounted costs, they add up. And if you reach that $3,000 deductible, then you would switch to coinsurance on that family plan. Now, a lot of people actually never even reach their deductible throughout the year. But if you do, you would switch to coinsurance for any additional services. So if you're an individual and you had paid $1,500 for medical and prescription services throughout the year, for any additional services and prescriptions you needed, you would only pay 20% in network. It would pay a little bit more out of network, but we're going to look at just the simple cost here. Again, if you're on the family plan, let's say employee plus spouse, one person or both persons' expenses added up to $3,000. You met that deductible, and anybody needed additional services, you would move to level 3 and pay 20% of the cost. Now, if you had lots of additional expenses throughout the year and continued to pay that 20%, that would add up. Once you had paid $6,600 for any individual, even if you're on a family plan, any individual who's paid $6,600 will not have to pay any more for their medical expenses on the plan. The plan will cover the rest. If you have 2 or more people on the plan, the most that your family would pay would be $13,200. So again, a lot of people never reach the out-of-pocket maximum. A lot of people never reach the coinsurance amount, but you have that protection there. So if you did have an expensive year with a lot of services, you have that protection built in. So let's look at the buy-up high deductible health plan. Again, we start at the bottom with that preventive care covered 100% for everybody, but your deductible on this plan is going to be a little bit higher. So it's actually going to be $3,000 for any individual, up to $6,000 for an employee plus 1 or more. Now, you remember on the basic high deductible plan, I said if you have 2 or more people on the plan, you have to meet the full family deductible. That is not the case on the buy-up plan. You have an embedded deductible. So that means any individual on the plan, even if you've got 5 people on there, if any individual met $3,000, they would have met the annual deductible. Now, if you do have additional people on the plan and you as a family reach $6,000, you would reach that annual deductible and move on to level 3. But on this plan, you actually have 0% coinsurance. So if you actually had paid $3,000 for an individual, you would also have reached your out-of-pocket maximum. And so one individual would not pay any more for their services. If you had additional family members, though, on the plan, you might incur some additional expenses, again, up to that $6,000. So really, on this plan, the annual deductible and the out-of-pocket maximum are the same. So if you reach your deductible, you're done for the year, and the plan will cover the rest. You're not actually going to pay any coinsurance. So let's try to look at these 2 plans side by side. So again, your preventive care covered the same on both plans at 100%. Your deductible for employee only on the basic is $1,500. The buy-up is $3,000. If you have employee plus 1, so that could be employee plus spouse or employee plus child or the whole family, your deductible on the basic is $3,000. On the buy-up, it's actually also $3,000 for an individual, but up to $6,000 for family. Your coinsurance on the basic, so again, coinsurance is what you pay after you've reached that deductible. 20% on the basic, but 0% on the buy-up. Then you have your out-of-pocket maximum. So that's your protection. The most that you would pay if you had an expensive medical and prescription year. The basic would be $6,600 versus $3,000 on the buy-up. If you have employee plus one or more, your basic, any individual would only have to pay $6,600, but you might have up to $13,200 for family. On the buy-up plan, again, you're paying more out of your paycheck for this. You're going to find that the out-of-pocket max is the same as the deductible, $3,000 per person, up to $6,000 per family. Now, the high deductible health plans are paired with a health savings account. So again, that bank account that gives you money to pay for those expenses on the plan. So basically to help you pay for expenses adding up to the deductible. The college gives you money, $750 on the basic or $600 on the buy-up. If you have employee plus one or more, you're going to get $1,500 on the basic or $1,200 on the buy-up. And we'll talk about how that works a little bit more. However, you can also earn an additional $500 per year into your HSA by completing the Pima Healthy Rewards program. And now you can see the premium amounts on this slide as well. So as I mentioned, the basic high deductible health plan has no cost for employee only. The buy-up plan, though, does cost $500. And then you can see the premium amounts for all of the different levels of coverage. So of course, your basic is going to be the least expensive premium available on all of the college's medical plans. And then the buy-up, you're paying a little bit more. Again, why might you pay more? It might be because your out-of-pocket maximum is so much lower. So you're kind of paying for that in extra insurance so that if you did have an expensive year, you'd know that you would only have to pay $3,000 for an individual on that plan. Now, if you need any domestic partner rates, you can find those in the benefits guide. As I mentioned, the high deductible health plans do include prescription coverage. But before we go there, I want to talk about the Pima Healthy Rewards program. So I mentioned that you can earn an additional $500. You might also choose to, at this late point, just earn $260, but that would be deposited directly into your health savings account. To earn the $260, you get 3 items to complete and record in the portal. Participate in a biometric health screening. Those are happening on site at the college in April, or at a local laboratory in April and May, or through your physician's office. You'll use those numbers to complete the My Blueprint Health Assessment, and then complete 1 local employer activity. And there's a whole long list of those. Those are basically PCC Employee Wellness Program activities that are designated to qualify for Pima Healthy Rewards. One of those is being tobacco-free. So those 3 items get you that $260. But if you're completing additional items and earning additional points and you hit that magic 20-point number, you can earn the full $500. Everything must be completed by May 31st. And then we'll start again on July 1st. So prescription coverage, again, and that is through Express Scripts. And that you're automatically going to be enrolled in that. Now remember, the high deductible health plans combine your medical and prescription costs together. So if as you're paying for either prescriptions or medical services, they're going to add up towards your deductible amount. You can fill at a retail pharmacy, 30 days. You can also fill a mail order. Now the mail order gives you 90-day supply, and then the college is offering a new benefit for a 90-day supply. It's called the Smart 90 program, and starting July 1st, you can get a 90-day script not just through mail order by going to a local Walgreens. Now again, remember, if you have a lot of expenses and you were to meet the deductible on the basic plan, you would switch to 20% coinsurance. On the buy-up plan, you would actually not incur any additional expenses throughout the year. There is a little difference for diabetic supplies in that instead of paying a discounted cost or a coinsurance amount, you actually have co-pays set because diabetic supplies are considered a preventive service. And that allows you to make sure that you can still access everything that you need without having to meet that full deductible. So how do you know how much something costs? I've said you pay the discounted cost for a service or a prescription. Well, let's look at healthcare costs. You can go to the Blue Cross Blue Shield website and click on Healthcare Cost Estimator. And that will allow you to look for all different types of conditions or services, and it will give you kind of the total cost amount, how much you would pay on the plan. And then also if there are opportunities for savings. It does make a difference sometimes where you go to get a service. For example, a hospital service is typically going to be more expensive, but you might be able to get that same service at an outpatient facility, or perhaps your physician even offers something in the office. So those savings opportunities give you a way to really hone in on the least expensive options. You can also use that calculator to compare side by side for different facilities so that you can choose a facility that perhaps is a little bit less expensive. On the prescription side, if you go to Express Scripts website, you can do a price of medication. So you can type in what it is that you want to get a cost for, and it's going to pull up the amounts that you pay. It's going to show you the 90 days, the 30 days. Now in this case, I picked a really expensive name brand medication, and then you can see that you can also pull up a generic option, and that will give you the cost for that. So it's a great way to find, again, the least expensive costs available to you. So I want to talk more about health savings accounts, since these go with your medical and prescription plans. Our health savings accounts through the college are managed through Health Equity. They are a bank account that allows you to put money aside, as well as the college, pre-tax, to use for medical expenses. And this is a broad range. It's medical, dental, vision, healthcare expenses. But there are some IRS eligibility rules. And those are, you have to be covered by an eligible high deductible health plan. So the college has eligible plans for you. You cannot be covered by any other health plan or be claimed as a dependent on another's tax return. So for example, you can't look at the rates and say, well, I want that zero employee only cost plan and still be covered under your spouse's insurance. You would have to let go of that other coverage before you can start your coverage with a high deductible health plan and a health savings account. You cannot be entitled to Medicare, IHS, TRICARE, or have received VA benefits in the past 3 months. You also cannot have a healthcare flexible spending account. You can have a limited purpose flexible spending account, which we'll talk about a little bit later. But if you currently have a healthcare FSA and are on another plan like the PPO or the EPO, you're going to want to make sure that your balance in your healthcare FSA is $0 on June 30th so that you are eligible to have your HSA on July 1st. Now, your HSA rolls over from year to year. So if you put money in over the next year, anything that's left just rolls over to the next year. It belongs to you. So it's your bank account. So if you leave PCC or you retire, you get to keep all the money that's in there. Does come with a little bit of responsibility because the HSA is for qualified healthcare expenses. You need to keep all your receipts throughout the year. There are also a couple tax forms that you will work with at the end of the year. They're really simple and easy, but you do basically need to report that you had that health savings account each year. If you choose to use the money for non-healthcare expenses, you are going to be subject to taxes and penalties. Although that does change once you reach the age of 65. When you're 65, if you still have money in your health savings account, you have a couple options. You can continue to use money for qualifying healthcare expenses. You'll pay no taxes. You'll pay no penalties. But if you want to use it to go on vacation at 65 and over, you can use the money for something like that, but you would pay tax on it at that time. Otherwise, though, this is all tax-free money. Just like the IRS sets eligibility rules, it also sets limits on the plan. So you can contribute between you and PEMA, $34.50 for an employee-only plan on a calendar year, or $68.50 for a family plan. If you are over age 55, the IRS lets you put an additional $1,000 in per year. So let's look at what that means. You saw the amount earlier, but on the basic high deductible health plan, if you're enrolled in that, the college is going to give you $750 into your HSA if you're employee only. If you're enrolled in a family plan, the college is going to put in $1,500. A third of the amount is front-loaded on July 1st. So you can actually start out the year with a chunk of money that you can use right away to fill a prescription or pay for a service at the doctor. And then the rest of the amount is put in through the rest of the year. If you're on the buy-up, you're going to get $600 for employee only, $1,200 total over the year for a family. Again, a third of that amount will be front-loaded for you, and the rest put in paychecks throughout the year. Remember that PEMA Healthy Rewards, though, lets you earn an additional $260 or up to $500. That is your money that goes into that health savings account for you to use. So you can contribute the difference up to the maximum. So we saw that amount on the other slide. The IRS says you can put in, for example, $34.50 as an individual. So if you wanted to figure out how much can you contribute, you take $34.50 minus maybe $750 minus another $500 because you earn your PEMA Healthy Reward, and that's the amount that you can put in. Remember, though, if you're over 55, you can contribute an additional $1,000. Now, most people are going to want to contribute a prorated amount. So what that means is that the IRS allows you to put in $34.50, for example, in a year. But since you're only enrolled for 6 months out of the year, you might want to cut that amount in half. Unless you plan to be enrolled all of 2019. The IRS amounts are by calendar year, and so you can actually contribute the full amount this year, but the IRS says you have to be enrolled in the high deductible health plan and HSA for all of the following tax year. So always be cautious with the IRS amounts of what you decide to contribute to stay within the maximums. And I would be happy to answer any individual questions you have, as well as anyone in the ESC about how that works. Now, why do you want to contribute? Because you get triple tax savings. So there's a definite advantage of contributing as close to the max as you can each year. So everything that you contribute is not included as income. So you don't pay taxes on that money. So obviously, if you're paying out of your paycheck, it comes out pre-tax. But if you were to put in money outside on your own, you would be able to claim that on your tax return, and you wouldn't pay tax on those contributions. all of the interest money or investment money that you receive in your account for as long as you have that open is also tax-free. You don't have to pay taxes on any of that interest income, which is another nice benefit. And then as long as you're using the money for qualified expenses, you never pay tax on that money. So you get the pre-tax contribution, the tax-free growth, and the tax-free withdrawals. So it's a great way to put money in there to save for retirement. Health expenses are going to probably continue to go up over time, so we can help plan for retirement by having that money available to cover healthcare expenses as we get older. So again, as I mentioned, you can choose your pre-tax sum, or you might also deposit post-tax amounts to build up your funds quickly and then claim that on your tax return. The simplest way is to just pick a dollar amount when you're doing your annual enrollment and have that money come out of your check and have that build up over time. There are also a couple other options. If you actually had a health savings account in your past, you can roll that over from that account into the new account. You also can do a one-time rollover from an IRA. And that, again, is a once-in-a-lifetime opportunity. And it is limited to those annual dollar amounts. But it is possible to transfer from an IRA. And there's no penalties for doing that. And that can be done directly through Health Equity. So if you decide to have your health savings account, you always want to, get the most for your money. So there are options within Health Equity to maximize your tax-free earning potential. Because remember, any investment income that you make, any interest income you make, you will not have to pay taxes for. There is a low-risk yield plus upgrade that you can choose for additional basically interest every month. I'll show you those dollar amounts in a moment. And you can also invest in mutual funds. And there are a couple different options. You can pick and choose on your own which mutual funds you want to invest in. And there's no cost for purchasing those or trading those. Or Health Equity does offer an advisor service that's a web-based automated investment advisor. And there is a monthly cost to that, but that is meant to help you make the most of your earning potential. Now, if you enroll in the high deductible health plan and you get your Health Equity HSA account, you're automatically enrolled in the basic FDIC cash account. Remember that you will get a debit credit card and you're going to use that to activate it. You also want to set up your online account so you have easy access to your money. And I also suggest that you elect electronic statements because that will save you $1 every month. So here are those interest rates on the FDIC cash. So of course, the more money you build up in there, the higher the interest rate. Again, remember you have that investment opportunity available to you. Now, if you want to upgrade your account, you can see some other dollar amounts on there for you. So let's talk about how you use your health savings account. So you can use it for yourself, for any qualified medical expenses. You can actually also use it for your spouse and any of your IRS qualified dependents. So even though they might not be on your health plan, you can still use your HSA money. Just make sure you have enough to cover your own expenses. Now, the HSA has a publication by the IRS called Pub number 502. And I suggest that you actually go ahead and read through that to read all of the different things you can use your money for. You're going to find it will cover dental, vision, all types of healthcare expenses. It even covers some type of expenses that might not be covered on your medical plan. There's no time limit, of course, on using the funds. So once you're enrolled, any expenses incurred after that enrollment date, you can use your HSA. And as I mentioned, after age 65, if you want to spend your money on non-healthcare expenses, you can do that. You won't pay any penalty. You'll just pay income tax on the distributions. So when we look at these together, at July 1st, PCC put some money into your health savings account. As you go for any services, medical services or prescription drugs, you can pay with your health savings account, or you can use your own funds like a credit card or check or cash, and then reimburse yourself later. Remember that your preventive care is covered 100%. So if that's all you need, you might not even use your health savings account or other funds. Once you meet your deductible, then you find that you might pay a percentage and the plan pays a percentage. If you reach the out-of-pocket maximum, then the plan is going to cover 100% of the cost. And if you had any money left in your HSA, that's going to roll over from year to year. So on July 1st, let's say you visit your provider, you go to a hospital or you fill a prescription, the doctor or the facility, they're going to take your insurance card, note that you have a high deductible health plan, and then they're going to submit it to the insurance and bill you afterwards. If you're going to fill a prescription, they are actually going to check your deductible balance right away, right there, and you'll be able to pay the amount due every time you fill a prescription. Same thing with the mail order. Now, Blue Cross Blue Shield or Express Scripts, that's ESI, they're always going to check your deductible balance and your out-of-pocket maximum before they tell the prescription provider or the healthcare provider how much you owe. At that point, you can choose to pay for the service with your health savings account. If you have money available in there, you can use a debit card, you can order checks if you want, or you can use the online bill pay, or you can choose to pay with your own methods and then reimburse yourself later. Now remember, if you have reached your out-of-pocket maximum, you won't have any additional payment due. So there's no substantiation of claims required by health equity. However, the IRS requires you to keep your records. So you want to keep all of your bills, your receipts, records of payments with your tax documents in case you were to get audited. And you're going to have one form, it's IRS Form 8889, that you submit with your annual tax return. So I put together some examples so you can see how high deductible health plan works and what kind of expenses you might incur on the different examples. I'm going to go through these pretty quickly, but again, you can download a copy of this presentation. So let's look at the basic high deductible health plan. This would be for an individual employee only. So that deductible is $1,500. So if you go in for a doctor's visit, they might charge typically $125, but you're just going to pay the discounted cost. So that means Blue Cross arranged for a $75 amount, and that amount is going to apply to your deductible. So your deductible balance gets lower. Then you go and fill a prescription. Might normally cost $100, but ESI costs only $70. So you'll see that amount is subtracted from your deductible balance. Then you go for a well-man exam. Well, that's covered at 100%, so you actually don't pay anything, but your deductible balance stays the same. Then you fill another 90-day prescription. Again, you see that deductible balance going down. Then you need to go to urgent care. Again, you pay that discounted cost, $160. That's going to be applied to your deductible. Again, keep going for some outpatient therapies, and you'll see as you continue to pay that discounted cost, it's all going to add up towards your deductible, and your balance is going to continue to go down. So in this particular case, at the end of the year, you actually paid $631 out of your pocket. But if you used your health savings account, and remember the college is putting $750 plus maybe an additional $260 or $500 in there. If you use that money, you actually had no expenses. And you have $119 left, possibly more, in your health savings account that you can roll over from year to year. Sorry, I meant to hold that for a second. So in this case, you paid $0 for the plan itself, the premium, and then by using your health savings account money to cover all your expenses, you actually had no cost and got to save some money for the year. Now let's look at the same example on the buy-up high deductible health plan. So again, this one starts with a $3,000 deductible. You go in for your doctor's visit, pay the discounted cost, that applies to your deductible. So same example with your prescriptions, your Wellman, etc. Anything you pay is going to continue to apply towards that deductible balance, just like our other example. Again, it's a total of $631. Now, in this case, you only received $600 from the college in your health savings account because you didn't also earn your healthy rewards. So it actually cost you $31. You also did pay $500 in premium. So your total cost for the year was $531. So in this particular example, healthy year, the basic plan actually costs you less than the buy-up plan. However, you may be more comfortable knowing that if something were to happen, you wouldn't pay more than $3,000. So that, cost might actually be worth it to you. Let's look at a different example. Again, an individual or employee only. So we start out with that $1,500 deductible, easy doctor's visit. We filled 5 prescriptions this time because it was a busy doctor's visit. But again, all that money applies to your deductible, and that balance is going to continue to go down. And of course, a well woman exam is going to be covered 100%. So that is nice. And then we have a bad year. We have to have knee surgery. It actually costs about $25,000 without insurance. Blue Cross negotiates a discount of $16,000. But we're not actually going to pay $16,000 because we have a deductible of $1,500. So our deductible balance was $1,200 when we went for the knee surgery. So we're basically going to pay the balance. We're going to pay $1,200 to meet our deductible. And then that gives us a balance of $14,800. Well, again, we're not going to pay that. We're only going to pay 20% of that. And that's $2,960. So now we've paid just over $4,000 for a knee surgery. We've met our deductible. Then any other services, follow-up services that we need, we're going to only pay that 20% coinsurance amount. So whether it's urgent care or outpatient therapy or prescriptions, we're only going to pay 20% of those costs. So in this example, we actually paid $4,549. We used our $750 HSA contributions, and so we have $3,799. So less than $4,000 in cost for a really expensive year. And if you had put money into your health savings account, that less than $4,000 would all be paid out of pre-tax money. So again, under $4,000, that's our basic high deductible health plan cost in this example. Let's compare that to the buy-up plan. So same example, we have the doctor's visit. It's just that that deductible balance is starting higher at $3,000. So we're paying until we hit that knee surgery. Now, in this case, our deductible balance is $2,700. So even though it costs $16,000, we're only going to pay $2,700. Now our balance is zero. On this plan, once we reached the deductible amount, there's no coinsurance. So all the other services are covered at 100%. So on this plan, we paid then $3,000 total. Now let's say we used our $600 health savings account money. That means we paid $2,400. We also paid $500 in premium. So our total cost was $2,900. So in this case, it was actually worth it to pay that buy-up plan because it cost us less at the end of the year. Let's look at one last individual example. So this is kind of, again, a fairly healthy individual. You might just go for a few doctor's visits and some maintenance drugs. As you go for those, you pay the discounted cost, and that's going to keep going towards your deductible. Again, your preventive services are free. And we add up at the end of the year, $420. If we used our PIMA college contributions to our HSA, that easily covered it. It cost us nothing. Now, we earned our full wellness incentive in this example, so we actually start off next year with $680. And that's without us contributing our own money, which, again, that's something that we really do want to focus on as well. Now, let's look at this on the buy-up example. So again, that balance, is starting a little bit higher. That should have the $3,000 amounts. We have that $520, but we also paid $500 in premium. We still get that rollover amount. So on this case, it probably wasn't worth it to have the buy-up plan, but it cost us $500 again for that maybe extra insurance. So let's look at a couple family plan examples. So basic family example. And this one gets a little bit more complicated, but let's take a look as we go. So we have a pediatrician visit. We pay the discounted cost. Now, remember, our deductible is $3,000 because we have 2 people or more on the plan. Now we go fill prescriptions for the whole family. We pay that cost. Everything we pay is going to be applied to the deductible. Well woman exam, though, covered 100%, doesn't apply. So in this family example, dad needs knee surgery, $16,000 like we saw before, but we're going to start off with that deductible balance. $2,475 is what we're going to pay. That brings us to our full deductible, meaning we're going to pay 20% on the remaining cost. So 20% is $2,705. So the knee surgery in this case cost almost $5,200. Now, a child on the plan, they go to urgent care. They're also in the coinsurance because the family deductible was met of $3,000. So that means everyone's paying that 20% coinsurance, whether it's outpatient therapy or more prescriptions. Again, only paying that 20%. So total cost, $5,839. Now in this particular case, we got $1,500 in HSA money from the college, plus an extra $500 for the wellness incentive, so we could apply that. That cost us $3,839. Then we also paid $4,120 out of our paycheck. So our total cost for the family for the whole year was $8,000 with all of those services. Now let's look at the same example on the buy-up high deductible health plan. So we're going to split it up here because in this case, on the buy-up plan, we have a per person deductible, and then we have a family deductible. So that's why we're going to start splitting this into mom, dad, child 1, child 2. Now everyone's are going to start adding up towards the deductible, but they're going to kind of vary. So it depends on which member of the family is receiving services. So in this case, the mom had prescriptions, the dad had prescriptions, the child had prescriptions. So we can keep track of the deductible amount per person as well as for the whole family. Well, woman exam, $0. Now, same knee surgery example. Now, in this case, we're looking at $13,525, which we're not going to pay. What we're going to pay is the individual, the per person deductible balance. So on this plan, it said one person's expenses will not exceed $3,000. So we're just going to pay $2,650 for dad. That amount, though, is going to still apply towards the family deductible. So on this case, the child has services next. Well, the child has not met the $3,000 per person deductible. So he's going to have some expenses there, $160, but it's going to change the deductible balance for that child. And that amount paid is also going to go towards the family deductible. Now, dad has additional services. Well, he actually met his per person deductible, so he's not going to have to pay anything else for his. Now, we go to fill all those prescriptions again. Now, dad's not going to have to pay for any prescriptions because his per person deductible was met, but mom still has not met her deductible, and child 2 has not met his or her deductible. So we're going to pay a little bit for each of those people. But again, it's going to add towards that full family deductible. So in this case, the total costs that we paid were $34.35. We can subtract the full wellness incentive HSA contributions of $1,700 here, and then that gives us a balance of $1,735 that we could pay with the rest of our HSA funds. The premium was a little bit more than the basic plan, so we paid that as well, and the total cost was $63.55. So the buy-up family plan example, $63.55 total costs for everything out of pocket and premium, compared to the basic, which was about $8,000. So there was a significant savings available by moving to the buy-up plan in this particular case. So how do you figure out how to do this for yourself? You can use the estimated benefits calculator on the intranet. So there you can go on, and it's going to be under Employee Service Center Open Enrollment, called Estimated Benefits Calculator. You can try to estimate your expenses throughout the year and have those dollars added up for medical services and prescription services, and try and figure out which plan might be the best for you and which plan costs the least to you at the end of the year. There are definitely some ways to save money. If you're enrolled in the high deductible health plan, take advantage of all your preventive care. One, it's of course covered at 100%, but also the healthier that you are, the less expenses you have over time. So working on not just the screenings, but working on lifestyle issues will definitely save you money along the way. Using convenience care and urgent care is always going to be a less expensive option than going to the emergency room. You can also use the nurse line through Blue Cross Blue Shield. You get free 24/7 access to talk to a nurse. So you can give a call. You might not even need to go seek treatment anywhere. I also recommend that you research the costs for your medical and prescriptions. You can find sometimes a difference between pharmacies. So shop around to get the best price, and the same for your medical plan services. And then, of course, if you need any type of counseling services, use the Employee Assistance Program through Jorgensen's Brook. That EAP offers you free counseling sessions each year. So one last thing on a flexible spending account. I mentioned you could not have traditional healthcare FSA along with your plan, but you can have a limited purpose FSA, and that amount actually is bumped up to $26.50 per year that you can put aside pre-tax, and that's going to be for dental and vision expenses only. And it is a use it or lose it plan, so very different than the HSA that rolls over. The FSA, if you elect a limited purpose account, you want to make sure you budget to use all of that money. You do get an additional 75 days after the plan year is over to incur those expenses and some additional time to submit all your receipts, but you want to make sure you use all of that money. You can purchase a debit card for a limited purpose healthcare FSA if you wish, and that's $18 a year each year, or you can just submit using the website and or paper forms. So if you're thinking about this, you might decide to go ahead and switch because the high deductible health plans have no or low premiums compared to the other plans. You're only paying for the services you need while still getting that 100% preventive coverage. And then the HDHPs and HSAs really allow you to save money for future medical expenses. So if you're looking to make changes, if you want to enroll in one of these plans, you can do that this year through Banner Self-Service Online, and that's going to start April 16th through April 30th. You can also use paper forms available on the intranet. Now, if you don't choose a high deductible health plan and health savings account and you want to stay on the PPO or EPO and re-elect a flexible spending account, you must re-enroll every year. If you happen to have a health waiver, you must resubmit that in order to maintain that benefit. Otherwise, if you don't want to make any changes to your health and dental plans this year, you can leave everything the same and your current options will roll over. One thing to note on the high deductible health plans and the health savings accounts, you can change your HSA amount anytime throughout the year. So if you pick an amount for July 1st and in October you want to change that amount, you can definitely do that. Just remember that if you do want to make any changes, that must be made by April 30th. So if you do have any questions, I'm going to direct you to the Employee Service Center. And so you can give us a call at extension 4945. You can email us at esc@pima.edu, or you can check on the intranet for additional information, or come to any of the upcoming benefits fairs in April and meet with a representative in person and get your questions answered. So if this didn't fulfill all your needs today, please contact the Employee Service Center. We're more than happy to help get all your questions answered on your HDHPs and HSAs. So thank you for listening and have a great day.